Hey, good morning, everybody. Glad you could join us. Looks like we have quite a few visitors joining us today, which is always wonderful. Happy to see everybody. So we are recording this meeting. So we just ask that everyone stay muted unless you're speaking. When you do speak, it'd be very helpful if you could start by saying your name. And the recording will be up on the Long-Term Care Planning Committee website within 24 hours of the end of this meeting. And with that, I'm going to turn it over to my colleague Heather, who is going to quickly call the roll of members.
Thank
Heather?
you so much. Thank you so much, Melissa, and good morning, everybody. So I saw that Senator Seminar has joined us, and I don't believe there's any other legislators at this time, but if you are here, please let us know. I'm going to continue with the roll call. Melissa Morton.
Present.
Thank you. Amy Dumont.
Good morning, present.
Thank you. William Seals.
Present.
Thank you. Kelly Kendall. Aaron Levitt. Oh, Kelly, there. Thank you. Sorry. Aaron Levitt Smith.
Here.
Kim Hirschniak.
Here.
Amy Porter.
Here.
Jessica Rival.
Good morning, present.
Thank you. Lisa Rivers. Michael Santoro.
Present.
Thank you. And Laura Watson.
Here.
Thank you. Back to you, Melissa.
All right, thanks so much. So once again, welcome. We have a couple of new members who are joining the planning committee. And I would like to take a moment to just allow them to introduce themselves. Jennifer Cavallero has left the Department of Social Services, and filling in for her on the committee, I think just temporarily, Amy, although we would love to have you permanently, is Amy Dumont from the Department of Social Services. Amy, I don't know if you want to say a little bit about yourself and your role.
Oh, sure. Good morning. I'm Amy. I'll be in the role on an interim basis. And we'll see what happens beyond that. Thank you for inviting me, Melissa. I've been here at the department for the past 17 years. I work on all of the Medicaid waiver programs and have been doing that throughout my tenure. I am a licensed clinical social worker, and that's it. So I just thank you all for having me.
Thanks, Amy. And I would also like to welcome our new representative from the Department of Children and Families, William Seals. Hi, William. Would you like to introduce yourself?
Absolutely. Good morning. My name is William Seals with DCF. Been with DCF for 19 years, and I'm new in the role of interagency transitions. So I work with our agency partners, DMIS, DDS, DSS, CSSD, et cetera, et cetera. So I am also a licensed professional counselor. And if there's anything, regarding DCF and our interaction with our partners, I'm the person to reach out to.
Great. Thanks, William.
Thank
And
you.
I see Senator Summers has joined us. Welcome, Senator. Happy to have you.
Hi, happy to be here. Sorry I'm a little late.
That is fine. It is one of those days with several competing priorities. So with that, because many of the members of this group today is a big bill signing with the governor, and I know that many of us on this group have to go attend that bill signing. So we are going to move right along and get into the meat of the meeting. And so the first order of business on our agenda is going to be to approve the minutes from our March 14th meeting. And so hopefully everybody received the minutes. They were sent several weeks back. So hopefully you've had a time to take a look at them. Do I have a motion to approve?
Motion to approve.
Thanks, Michael. Second?
Second, this is Amy Porter.
Thank you, Amy. Second. Any abstentions? I'm going to put William and Amy down. Amy Dumont as abstentions, correct? Yes. Okay. All in favor?
Aye.
Aye.
Any objections? Okay, with that, our minutes pass. And now, the meat of the meeting today is going to be to provide an update on the 2023 legislative session. We typically do that at our June meeting, but with the timing of the end of session and the timing of our June meeting, it would have only given poor Heather 2 days to put together a legislative summary for what ended up being an extraordinarily busy session in the long-term care services and supports space. So I appreciate everyone's flexibility and bumping the meeting out a month so that we could complete a more thorough review of the session. The final legislative update was sent to all of you this morning. It's also been posted on the Long-Term Care Planning Committee website. If you didn't receive it, you can go on our website and download it. Just to give you some context, typically our LTSS legislative update is around 3 to 5 pages long, and this year I think it's 10 or 13. It was a very, very busy and productive year in this space. So with that, Heather can't possibly, in the short time we have allotted, go through the details of every single bill that was passed. So she's going to highlight some of the bills we think are most germane to the work of this group that speak most directly to our long-term services and supports 3-year plan. And then as we go along, if any of you have items you want to add, or if you think that there's an important piece of legislation that we didn't cover in the verbal update, but that you would like to bring forward in the group, there will be an opportunity to do so after Heather's presentation. So with that, Heather, I turn it over to you.
Thank you, Melissa, and thank you all for being here. And as Melissa mentioned, there's hundreds of bills that were passed, and obviously a lot of people here have incredible expertise. Obviously, our legislators who are present and commissioners and other folks who are very involved in this work. So I very much welcome your comments and additional context at the end, because there, as I said, because we're also by the nature of the volume of the number of bills, it's just a very, very high level overview. And so there are 17 bills that are in the written report, and today I'm going to focus on 5 of them. So once again, if something that you want to talk about is not one of those 5, please, you can share. We'll make note and share that at the end. And one of the 5 that we're talking about, 2 of the bills that are having the ceremonial signing today in Windsor at 11:30, I'm going to be talking about one of those. Obviously, the act concerning adult day centers is important as well, but once again, that's too many bills and not enough time. So the first one I'm going to talk about is Public Act 2348, which was House Bill 5781. And this was an act concerning, very long title, act concerning a notice of a proposed involuntary transfer or discharge of a nursing facility resident, family councils and managed residential communities, coordination of dementia services, nursing home transparency, and homemaker companion agencies. This bill, if you ever had looked at it from its inception, it was originally an act concerning a study of the needs of senior citizens, and then it wound up being a vehicle for a lot of the priorities of the Aging Committee. So there's a lot of different components to this bill. And a lot of, as you all of you are probably familiar, a lot of the provisions of this bill were also a result of the work of the Homemaker Companion Task Force and the work that they did there. Can everybody, if you're not speaking, if you can just put yourselves on mute, please. Thank you. All right. So the first of these sections, I'm going to talk about sections 1 to 3 first, which is about involuntary transfer discharge notification. Just requires the notification of the long-term ombudsman. It's the bill's written ombudsman, but of course there's other legislation now changing the nomenclature to ombudsperson. So our ombudsperson will be notified of those. Also establishing family councils where they don't exist. Section 6 is a dementia services coordinator at the Department of Aging and Disability Services. And so once again, to have more, there's a lot of, as we know, there's a lot of services out there that are available and sometimes people don't know. And so I think these coordinator positions really help provide, unified communications, and it's helpful for the population and for residents to have this information presented and accessed through one person. Then the next section of bills I'm going to talk about, subsection of this bill. I call them bills because a lot of them were bills on their own and then got added to this. But the next provisions, sections 7 through 10, are really mostly about transparency. And that's what a lot of the bills do this year, increasing transparency, which obviously is vital. So nursing home facility cost reporting requirements, the narrative cost expenditure summaries need to be sent to DSS. Nursing home private equity ownership, requiring licensure applicants to disclose any private equity company or real estate investment trust that involves part of the home. And then related party income reporting, chronic and convalescent homes that receive Medicaid funding report annual profit and loss statement, and from any related party that receives at least $30,000 of income from the home. And the Medicaid rate setting guidebook for nursing homes that the DSS commissioner will post and develop and post. You got to develop it before you can post it. Guidebook that explains in plain language the net Medicaid nursing home rate setting process. So that's the transparency requirements. And then the next set of provisions are primarily from the working group that I mentioned earlier, the Homemaker Companion Task Force. And so the first one is a transition plan to look at moving oversight for Homemaker Companion agencies from the Department of Consumer Protection, where it currently resides, over to DPH. Obviously, that was a big focus of the working group, and having continuity of these types of services all under one agency. And the next is, while it still is under DCP, there's a lot of provisions that relate to DCP, such as DCP having the ability to revoke, suspend, or refuse to renew a registration of a Homemaker Companion agency if they're not giving written notice about the fact that they provide non-medical care. Also, that Homemaker Companion agencies need to develop person-centered service plans, and that there's oversight of the agency of the person who's providing the services, and talking about the meeting schedule there. Next, sections 13, 14, and 15 through 17 are also from the work group, requiring DCP to post on its website a guide detailing the process for consumers to file complaints, and also the advertising for Homemaker and Companion agencies. This was important because the current law prohibits the word care in titles of nursing Homemaker Companion agencies, and yet many of those agencies currently have that in their title, the word care. So now they're legally allowed to use the word care and to advertise when they provide caregivers who have been trained in serving people who are having memory issues and helping with memory care. So that's, as I said, a lot of provisions in one bill, and I'm happy to, I was planning to go forward, but if anybody has any burning questions or comments on that bill before I go on to the next. Okay. Next, next I'm going to talk about Public Act 2399, which was substitute House Bill 6767, and this was an act concerning the Department of Consumer Protection's recommendations regarding licensing and enforcement. So this actually flows nicely from what we were just discussing. It also comes from the work of the Homemaker and Companion Task Force. So this bill has a lot of provisions involving the Department of Consumer Protection, but the sections that are germane to long-term services and supports is the sections 18 and 19, which is about expanding the disclosure requirements for Homemaker Companion agencies, such as when an agency changes the service rates or stops operating, and also requiring background checks of certain prospective owners. So as I said, that's just a small subset of that bill. Next, I'm going to talk about Public Act 23-122, which is House Bill 6731, which is an act concerning the Department of Public Health's recommendations regarding change in ownership of healthcare facilities. This is primarily about the Department of Public Health, and also as a theme that we're seeing is about increasing transparency, that expands the circumstances when licensed healthcare facilities or other institutions that the ownership changes in the circumstances when they need prior approval. So it's changing the threshold. So now, if there's an ownership under 10% of the ownership, that is important for that to be seen. And that also if there's certain transfers to relatives, because they all currently apply to DPH institutions, but now it's also applying in all institutions and licensed healthcare. Then also that they are required to, the proposed owners have to submit more documentation, such as the copy of the sale and transfer agreement, organizational charts, and if they have any prior penalties or sanctions in other states, it also allows inspections. And they also have the importance of if there's past history where there's a relative that had applied and the application had been denied. So it's just really important, once again, more transparency, understanding who's buying the home and what the history is to make sure that everything is above board. So I also just want to take a quick pause to let you know that if you would like to follow along, because some people, myself included, are visual learners. And so if you wish to follow along, the link to the report is in the chat. Melissa put it there. And I am currently on page 6 of that report. Actually, the number may have changed because we took one thing out, and so I will update that, but I'm on Public Act 23-137. And these bills go in because they're acts now, they go in numerical order of the Public Act, not the House or Senate bill number. So this Public Act 23-137 is enormous. It was a substitute for House Bill 5001, which was the House Democrats' priority this year. It was a huge priority for the legislature. So it actually has 68 total sections in this bill, and I'm going to talk about, there's 25 of the provisions that I've covered in the report. I'm just going to highlight a few of them, and once again going over at a very high level. So once again, provisions that you're most concerned about or interested in, I encourage you to add that context later. So the first one, it's just, once again, as an overarching statement, this was very much a comprehensive approach. And it was a bill, obviously, that changed a lot over time and was definitely work in progress for a long period of time. But as I said, a multi-pronged approach to assisting the population of people with intellectual or developmental disabilities. So the first one is a transitional life skills college program, and it's requiring the DDS commissioner to develop a plan to establish this for people who are at least 22 years old, and that there will be a residential component. This is as part of the plan as it's expected. And there was a lot of work in this bill around transitional services, but most of that is around the State Department of Education, so not as germane to the work here, but that's in the bill as well if you're interested in it. Then next I'm going to talk about, I want to make sure I haven't lost my page. Looking at yeah, this was also a very big provision. Section 3 is reducing the DDS Medicaid waiver program waitlist. That was a huge priority. And so this is going to be obviously ongoing work. And then looking down at Section 5 as well, also looking at the Autism Medicaid waiver program expansion. That's also something that want to continue to get more people off those wait lists as well. And then backtracking a little bit to redefining IDD and service eligibility. And also a big issue had been whether IQ should be used in the determination process. So looking at, looking at what access, looking at barriers, looking at silos. And one of the things I'm going to talk about, I'll jump ahead again briefly, is sections 13 and 14. Look at having better coordination, having OPM, having a state agency online data portal for, bringing information together, streamlining it, and then having new program coordinator positions, one focusing on services for people with autism spectrum disorder and other for people with intellectual and developmental disabilities. So really increasing the working across silos and coordinating agencies. I'm going to move back briefly. The other piece that, as I said, I really love this fact that there's so many different agencies and initiatives here. Another big piece of this is the public safety aspect, working with public safety registration systems and the Department of Emergency Services and Public Protection, developing guidelines, best practices, sensory kits for emergency services personnel. So really, once again, looking at all the players who are involved, who can make a difference in the lives of people in this community. Then looking at sections 11, the Human Services Career Pipeline Program. As we all know, the workforce issue has been ongoing. And so this is one of many provisions. I haven't talked, I'm not going to be talking about Senate Bill 9 today, but that also had a lot of workforce development provisions in it. So that's something that I think got a lot of attention, and rightly so, during the legislative session. Then Section 12, the rights of people under DDS supervision, because once again, coming back to the person-centered planning and keeping that a primary focus. And then I'm moving on to sections 16, and that is talking about group home compliance with fire regulations. So once again, there's the safety issues and looking at housing that comes up, that'll come up later as well, but also IDD Awareness and Advocacy Day. And then looking at pilot programs, like looking at new and innovative ways to serve the population, and other studies as well, because obviously a lot of these areas we want to move quickly, but other areas definitely need to be more planful. And so a lot of this bill provides more than one study as well. And I've included the dates those reports are due back to the committees of cognizance. Also looking at transportation, which is huge, that we have a study on non-medical transportation and looking at modernizing and maintaining bus stops, looking at a pilot in Northwest non-medical transportation. And then once again, back to the advocacy and awareness, in addition to the Department of Emergency Services and Public Protection, we also have the DMV creating a video presentation that instructs and gives best practices on interacting with people with intellectual and developmental disabilities. And back to housing, so sections 53 and 54, they talk about supportive housing, then community-based group homes for people with intellectual and developmental disabilities reentering after being in corrections. And so that is another plan that is going to be developed. And then municipal affordable housing plans is section 55. And then last but not least, sections 56 through 59 talks about the ABLE accounts, so that when people are using these accounts, that ABLE stands for Achieving a Better Life Experience, so that income isn't counted against when accessing Medicaid benefits. And the compensation for family caregivers, because obviously they're a huge part of a lot of people's care, and so it's requiring DSS to apply for federal approval. And this was amended in the budget bill, so I will talk a little bit about that. But I think if I will get to that part in a second, but I'm 99% sure that the amendment was just that it is, instead of having a separate waiver application, it would be to amend the current waiver, but I'll confirm that. So 5001, huge bill. Once again, before I go on, just want to take a pause if anybody has anything that's jumping out at you or that you want to add before I move on. Okay, so onwards. So the other, as always, the budget and implementer bill is huge. I keep using that word huge, but there's a lot of legislation this year and a lot of bills that had multiple provisions. So some years there's a separate bill for the budget and the implementer. This year it's one big bill. So it was House Bill 6941, which became Public Act 23-204. So there are going to be 17 items that I'm going to highlight that are highlighted in the written report. I'm not going to talk about all of them. The first one that I mentioned is a line item around community first choice. It's under the Medicaid item, and it's a little buried, so I'm pulling it out for you right now, but it's adding agency an option for consumer employers to choose getting their services, agency-based services under the Community First Choice program. So it supports choice, increases access, and then once again, it just gives people care that reflects their needs and their wishes. And it actually accounts, the budget accounts for savings of 12.3 million in fiscal year 24, and then expects a cost of 3.1 million in fiscal year 25. The costs are higher in the out years, but I just wanted to focus on the budget for the biennium. So next, I'm going to move on to, once again, the compensation for family caregivers. And I appreciate that Krista told me that I was right. So thank you, Krista. So yes, that it just amends it so that that they can amend the waiver instead of applying for a new one. Next, once again, the idea of cross-agency collaboration, sections 261 through 263, 279 through 281, and 443. So many sections are summarized here. It's having the Autism Spectrum Disorder Advisory Council report to OPM and rather than DSS. And so once again, that having OPM be I'm biased because I'm OPM, but we're a great conduit for cross-agency collaboration. And so that will help with overseeing the operation of the Medicaid state plan services and the Medicaid waiver program for autism spectrum disorder services. Then also looking at eligibility for the state supplement program, that's section 272 that goes retroactive to up to 90 days based on when DSS received the application for folks who moved into residential care homes or a rated housing facility. Next, I'm going to talk about sections 275 and 291. This is looking at nursing home Medicaid rates. This is continuing the transition to the acuity-based reimbursement methodology, and that it's looking also at inflationary adjustments, coming up with a methodology in the future, but there will be no inflationary adjustments for fiscal years 23 and 24. And also requires more reporting from DSS to the nursing home about the metrics and about their rate withholds. Next, moving on to 276, similar to that, and flat rate for residential services, looking at actually, sorry, it's 277, looking at the rate increases, looking at the and a model for inflationary increases, but they're having a freeze in fiscal year 24. And then also freezing the residential care homes who get flat rates. They are having a rate freeze in fiscal year 24 at fiscal year 16 levels. Next is section 282. As you probably remember, the rates for complex care nursing service for pediatrics was raised, I think it was 2 years ago, and now they've increased the rates for adult complex care nursing services. So that's now more equitable. Then section 288, state contracted providers for IDD services, that they will be able to use funds for wage increases for certain intermediate care facility employees. 290, section 290 is a small change. It looks big. It says Connecticut Partnership for Long-Term Care Program Administration officially moving from the Department of Aging and Disability Services to the Office of Policy and Management. It's primarily the phone line that's moving. So there's a lot that OPM was already addressing for the partnership, and then it's the official moving of the phone line and public information being shared through OPM. Then working groups, as I said, studies have been a big part of the legislation this year. So there will be section 298 provides for a study on looking at excess licensed bed capacity and to evaluate that at skilled nursing facilities, and the report is due, the final report is due June 2024. And then finally, this is also something that's been on the minds of a lot of people. Section 302 is the Husky C income limit has been raised. The limit had been 143% of the temporary family assistance or TFA cash benefit, and it is being increased effective October 1st, 2024 to 105% of the federal poverty level or FPL after authorized income disregards. So what that means in practical purposes, if you using 2023 metrics, the current TFA cash benefit amount would be $700 for an individual and $946 for a two-person family. So with the new 105% of FPL, if you use the 223 marker, that would increase that to $1,276 per month for an individual and $1,725 for a two-person family. So obviously those numbers will change when it goes to effect in 2024, but it just gives a sense of what that increase will be. So that is the end of the quick overview of what happened in the legislature this year, and I welcome comments, questions, other context that I didn't share, or other bills that you also wanted to highlight for the group. So I'll pass it back to you, Melissa.
Thanks so much, Heather. Excellent job. I know you were trying to rapidly get through a lot of information since so many people have to leave, so appreciate it. That was a lot. Heather did a great job. Please take a look at the summary. If you have any corrections, revisions, additions, feel free to shoot me an email, and Heather and I would be happy to make any edits. But at this time, we'd like to open it up to our members to see if there are any bills you would like to highlight, anything that you would like to add to what Heather said. Happy to open up for comments if anybody has anything to add. Oh, very quiet group today. Okay, great. Well, thanks so much, Heather. Appreciate your good work. So at this time, I would like to just open it up for general member updates and announcements. Are there any updates and announcements from members of the Planning Committee? Yes, Commissioner Porter.
Thank you. Closed my laptop apparently, so lost my picture. So thank you so much for that presentation. Obviously, there was a lot this session, a lot to keep track of, but great energy out there. The advocates did a great job, really trying to make sure that we could expand our services. And I think the legislature really had a broad view of what they wanted to do with some of these pieces. So they all fit together very nicely. I just wanted to update that we last session were asked by the legislature to establish a senior center coordinator position, and so we now have done that. Claire, some of you may know Claire Cote from our state unit on aging. So I know she's going to the long-term care advisory meeting next week, but just wanted to let folks know that she is in that role and will be working with senior centers. And we've also started the process of initiating the paperwork we need to establish the dementia care coordinator position within our state unit on aging. So really excited about that, really excited about working in partnership with our area agencies on aging, and sort of as those roles have expanded, looking to move forward and with all of our partners. So thank you all very much.
Thanks, Commissioner. Any other comments at this time? No. Okay. So actually, Commissioner Porter did a fantastic segue. The next item on our agenda is to be comments from the Long-Term Care Advisory Council, but because they are also prepping to go to the bill signing, they couldn't attend today, but did ask that I remind everybody attending today's meeting that the Long-Term Care Advisory Council, which is our companion, whereas for those of you who might be new to this group, the Long-Term Care Planning Committee is established in statute and composed mainly of any state agency that touches the long-term services and supports continuum from birth through death. So we have 11 different state agencies that comprise the planning committee. The advisory committee, Long-Term Care Advisory Council, was also formed in statute and is a companion to the planning committee. The Long-Term Care Advisory Council is more made up of advocacy groups and the private providers, and is the arm outside of state agencies for organizations, individuals that touch the long-term services and support system. And the two groups work very closely together. They attend our meetings. We make sure a representative attends one of their meetings. We try to have them close together. Usually the planning committee happens, then the advisory committee meeting happens, so that we're working in tandem and keeping partners, both public and private, across the state apprised of what's going on in the long-term services and support space. Most importantly, the two groups, the Long-Term Care Planning Committee is charged with every 3 years developing a 3-year plan or vision for how the state wants to move forward its long-term services and supports programming. And the focus has been since 2007 on rebalancing the long-term care system to move from a heavy reliance on institutional-based care to shifting more towards allowing individuals to receive their care in the community, and then nudging a shift in the Medicaid financing of that care to be more from supporting institutional care to having more Medicaid funding options available for people to be able to receive Medicaid long-term services and supports in the community. And we have the goal of 75% of Medicaid consumers receiving care in the community versus an institution by 2025, and are well on our way to meeting that goal. But whereas the Long-Term Care Planning Committee might be in charge of actually producing that 3-year plan, we rely heavily on our partners from the Long-Term Care Advisory Council, who are really the boots on the ground, the people out there providing the services, hearing from the consumer populations, working with them directly, and seeing the challenges on a day-to-day basis to help inform the plan and provide feedback that helps us to create a 3-year plan that's has short and long-term goals, short-term goals that are achievable in the 3 years, and more long-range goals to look out for how we want to move the system over the course of 5 to 10 years. And they keep us honest when we put out our annual update on the plan, review it, and chime in on where we might be coming up short. Or places where the state is doing a great job. So that's where those partners, we really come together, and that plan ends up being a true joint effort. So I encourage folks, if you're able, to attend the next Long-Term Care Advisory Council meeting. It is next week, and I want to say it's the 19th, but let me just double check here. It is the 19th from noon to 2 o'clock. And the Long-Term Care Advisory Council is run by Stephen Hernandez and Michael Werner. And so I encourage you to reach out to them if you need any of the contact information. But please do try to join if you're able. It's a great group. Is there any other business that members would like to raise? Okay, any public comment from guests in the audience today? All right, everybody. Well, thank you so much for your time on this busy day and in the summer nonetheless. So I really appreciate it. Our next meeting is Tuesday, September 12th 10 to 12. If you're ever looking for meeting invite information, if you think you missed something, the Long-Term Care Planning Committee website always has the Microsoft Teams access information, agenda, minutes, meeting recordings, and any materials that were passed out during the meeting. So with that, I ask for a motion to adjourn.
Motion to adjourn.
Thank you, Michael. Second?
Second, this is Amy.
Thank you, Amy. Okay, all in favor?
Aye.
All right, we are adjourned at 10:42. Thank you so much, everyone. Have a wonderful rest of the summer.
You.
Bye.
You as well.